very much for joining us. So yeah, so we're looking obviously at the Pass by Everlife system today. So this session is aimed at providers who are already using the system. So it's around some kind of more of advanced features and things that people may have missed, analytics, that type of thing. So we are quite aware a lot of providers are using systems, but obviously it's quite a lot of information to take in at the beginning, and then it's that time to be able to look into systems and delve into them more. Hence why we're kind of doing a series of these sessions. So am I okay to hand over to you, Jess, to take it away?
Yep,
lovely.
Absolutely.
Thank you.
Thank you. So what I'll do is I'll start sharing my screen. So hopefully you should be able to see this. So for anyone who's using Pass, we do have customers that are using just care planning only, and then we also have customers that are using our all-in-one, which includes our roster. So at the moment, we have on our all-in-one solution, we have had 2 new features come out, which we are just about to actually release to all of our care planning only customers as well. So anyone that's using just care planning only and perhaps a third-party roster such as Care Planner. Those 2 new features are, first and foremost, is the big section in the middle of my screen is called the Care Journal. So what we've effectively done is we've given care providers the ability to, rather than like me, I have a notepad where I'm constantly writing things down all day. Sometimes I wrote things down so badly I can't read what I've written and I have to try and remember. What we've done is we've created this care journal so that as a care provider, if, for example, somebody goes into hospital, rather than writing it down or sending an email, they can actually manage and monitor that directly within Pass. So it takes kind of pride of place in our overall dashboard, which everybody has access to. And here we can see that I've currently got 3 journal items. We've got a hospital admissions and discharge one. I've also got a note to review safeguarding incidents, and I've got a HR one to check where somebody's DBS check is. So to create those journal entries, there is a pen icon in the top right-hand corner. I can click on this and it will then start to allow me to create my journal entry. So here is where I can decide on my category type. So is it HR? Is it an incident? Is it a training? Is it hospital admissions? For example, if a staff member has requested holiday, what's the impact that that's going to have on other areas of the system use and also customers as well? So if we select scheduling, it will automatically give us the date that it's occurred. We can change the time, but it will choose the closest 5 minutes. So it's saying 12:05 here. And then we can add in the item details. So we can say, for example, review staff holidays. It's here that we can then tag the employee. So which employee is it that's requested holiday? I'm going to say that it's Stephen as the example. And then what customers is that going to impact? So it could be that we've got Anthony, Sheila, and we've also got Miles, because those are the customers that Stephen is scheduled to go out and visit. We can also decide on who do we want to be able to see this. So obviously if it is something that's more sensitive, you can then reduce down who can see this. It could be people with a specific role within the system. It could be a custom selection of staff members as well. So again, you can be very specific with who has access to view these. And then we can decide on, is there a follow-up action that needs to happen? So if there is, we can tick this box and we can say what it is. So I'm just going to put in here again, review holiday. We can set the priority, is it a critical or non-critical? Obviously, because absence with employees does have an impact on customers and the visits that they have scheduled. Here, I'm going to say this is a critical one. We can assign it to a staff member as well. So I'm going to actually assign this one to Amira. And then we can say if there's a deadline on it. So if it's somebody needs holiday fairly quickly, I'm going to say that we're going to set this deadline today at sort of 12:30. And then we want to generate alerts for if that deadline has missed. So I can go ahead and hit save that. We've now got this new journal entry here and I can see it because I'm filtering on all. I can look at the ones that have been created by me. I can look at the ones that have been assigned by me. I can also filter on things like the category of it, the status, and also what the priority level is. And if I go into one of these, this is where I can then see the actions on it as well. So what's the status of it at the moment? Are there any comments that have been added? So I'm going to say hand it to Amira in here. and then hit save. So you can always see who has done and added a comment against it. So they have that kind of that audit trail against it, and we can go in and edit it, and we can add new notes. I can also change the status of it to in progress as well. So it's now showing as blue, but we've got this item because it is a priority critical item. So we've created that, but it pulls through into a couple of different areas. If there is an alert that pops up because it's overdue, those will pull through into the office section here. So we'll be able to see any items that have had alerts pull through on them. But every office also has a timeline. And at the moment, that timeline shows care events. But with the journal, it opens up the journal items as well. So they can then do an audit on all of the different journal entries. They can filter it by the different categories, the statuses and the priorities. And not just for the overall office, but if they go onto a customer's timeline, they'll also be able to see any journal entries that have been added against that specific customer, where they've been tagged as well. So they always have multiple touch points where they can see all of that information. The next biggest area that we released is called our employee checklists. So this one is already out and available to our all-in-one customers, but we are about to release it to our care planning customers as well. And the checklists is a way of companies being able to manage anything that is not necessarily care related, but is staff compliance, for example. So I've created various different checklists around onboarding. I've got training, I've got ongoing training. And within each of these checklists, we can then create items. So for my care workers of onboarding, I've got things like car insurance, DBS check, heavy lifting, mental health training, passport, right to work. With each of these items that they can create, they can decide on the priority of the item. They can also say, is there a deadline that's required? So if once somebody starts with their service, they can then say, yes, this needs to be done within a month, within a week, whatever it may be. They can also generate alerts for when that deadline has expired. So again, they can decide when they want to receive them. And the really important one here for me is the review required? Because sometimes, especially when a business starts to grow, they have lots of staff, they're using agency staff, they've got salary, they've got contracted staff. It can sometimes be really challenging to keep on top of that. And then having a separate system just adds to the complexity of that. So we've added this into Pass so that you can then say, let's take right to work, for example, has to be reviewed every 6 months. So we can say that, yes, this has to be reviewed every 6 months. And the office will then start getting alerts on when those reviews are due. So we're starting to pull in some of those compliance and those HR elements so that it really does give them a true all-in-one solution. The next item that we've got that's coming out, and I do just need to remove some of these so I can see it, because unfortunately my screen does move some things, is we're about to release our customer checklist. So this works in a very similar way to how our employee checklists work, but it's from a customer perspective. So every business can start to create their own customer checklist. So they'll have the option to create employee checklists or do customer checklists. So here we can then add a new checklist for a customer, and this can be multiple customers. We can give it a title. So we've given this one onboarding and it's the assessments. We can also add things like a description as well. So we're saying that this one is for our private customers. We can then also decide on who do we want to assign this checklist to, because it may not be everybody that needs to go through all of these different items. It may just be custom people. So we can say, yes, it's for all customers. Past customers can create tags as well, and tags are things like medical conditions or areas that they can tag both their employees and their customers with. So they can also assign it to people with just those tags. They can do a custom selection of customers, or they can select it as none, and it is a checklist that is there for them to use in the future. They can also decide on their read and write permissions for any of the checklists as well. So who do they want to be able to read a checklist and also write on it? And again, that's so that the right people have the right access to the right information, and also the right people have the right access to be able to change any information on that as well. Once that checklist has then been created, that's when we can then start to go in and manage and create our items. So we've made Pass so that people can make it specific to their business requirements. So There are no templates of items, but that's so that people can use their own terminology that their business that is used to. They're not having to kind of put people in specific kind of pigeonholes, for example. It's very specific to the individual needs. So we've created, for example, an initial inquiry item. We've got initial care and support plan, initial environment assessment, an external environment assessment, my personal care and support. There's no limit to how many items a checklist can have. And I can select all of those, and I can also add new items as well. So very similar to the employee checklist, this is where we can then start to decide on things like the priority level and the description. We've then also got, when are the deadlines required for it being completed? Do we want to receive alerts on when it's due to expire? And when do we want a review that's set on that as well? So it starts to give them real visibility on when are things coming up for them to review, which means they're not having to then go into the system and kind of look for things or put things into their calendar, put things into their diary, write notes down. I used to, back in when I worked in IT, I used to have post-it notes everywhere, and it was a nightmare and it was organised chaos. This gives people that one place to hold all of this information, and it gives them that information in a structured view as well. Once they've saved those items, they've created them, they can go in and they can bulk add items as well. So they can add as many different items that they want to. So though, if they've created items, they can then add them to as many different checklists that they need to. And then we can make that checklist active. Once we make it active, we can then go back. We can then go into one of our customers, and this is what the checklist looks like in a customer view. So they can see, as part of the onboarding assessment for Alfred, for example, he's got 5 items that haven't been done currently because we've got these that are listed here. We can see this one is overdue, so it will clearly give them when there was a deadline. We can then go into each of these items and we can start to update the status of it as well. So has it been completed? For this one, we're going to say that yes, it has. As part of this, we can also upload any external files against the documents as well. So they can keep that digital footprint of that document directly in Pass. They don't have to have separate files on laptops and things like that. It can all be held in the system. They can also upload multiple documents as well. So some systems do only allow people to add one document to certain things. We've given the ability to upload multiple documents. So if there are multiple files that relate to a specific checklist items, and you can even upload different file types as well. So we've got a PDF document and we've also got a photo. We can save and update that item. That then updates the status of it. So we can see this one has then been completed. We can see the date that it's been completed as well. And if, for example, like the internal environment assessment, if it had a review period, it will automatically populate when that next review is due, and they'll start getting alerts on when those reviews are due on the dashboard as well. So we're due to release this at the end of this week, and it will be going out to all customers. So all customers will get both the journal and both checklists as well. Going back into Pass itself, a really key item that we talk a lot about with our customers, and we've recently done a GP Connect webinar for both customers and people that are interested in Pass, and I can share the details of that webinar as well if anybody wants to join that. It goes into a lot more detail, and it also has a couple of our customers who were very much part of what that GP Connect looks like in the different access levels. So we're going to jump into GP Connect now, which is actually sat in one of mine because I'm not a registered clinician or anything, but I need to be able to show people. So I'm going to jump into Mike. One thing to note with GP Connect is that the GP Connect tab will only be available for people that have a GP Connect profile. So you can't see it if you are a carer, for example, unless you are a registered clinician, a care manager. It's very much locked down to specific roles within the organisation so that the right people have the right access. So anybody that doesn't have a GP Connect profile won't be able to see that tab at all. Anybody that does, not only can you access this information within the website of Pass, when you're logged into our Pass for Care app, you can also access it directly in the app as well. So it's extremely mobile. Clicking onto GP Connect, my username is locked, so I can't share my login details. It is locked to the user that I'm logged into Pass for. I can then go ahead and enter my password for it, and then it takes me into GP Connect. Now, it is reliant on several different sort of verifications. The first one being that providers have to have completed the NHS DSPT. If they haven't and they're interested in using GP Connect, we can support them in completing that. They have to have the NHS number and date of birth of the service user correct. And finally, the service user has to have opted in to their GP records being shared at their GP surgery. So the opt-in is sat with the GP, it's not sat with the care provider. There is a legitimate interest for a care provider to have access to this information. If somebody hasn't opted in, they just won't have access to it. So they can log in, but it will be blank. It's about 95% of the population now that have opted into GP Connect, to having their GP record shared. And if you go onto the NHS website, it does actually go into specifics of the GP surgeries as well and what the opt-in rates are at each individual GP surgery as well. So here on the summary, I can see things like my last 3 encounters, any active problems and issues, major inactive problems and issues, current allergies and adverse reactions, acute medication over the last 12 months, and current repeat medication. It is a read-only system, so it won't update any of the care plan. There does need to be that manual interaction, that human interaction in the system to change anything in here. But I can also go into lots more items on the left-hand side as well. So I can go into the medication section and I'll start to be able to see the acute medication, but it will give me further detail, the current repeat medication. I'll be able to see what's been discontinued, and then also all of the medication as well, and when it was discontinued. You'll also be able to see 4 discontinued reasons as well. So if we take here, for example, we've got this eye drops one, it was discontinued because the patient reacted badly to it. So they can see all of that information directly in here. They can also start to see administrative items such as, for example, on Mike, we can see that an appointment was sent out for a diabetes clinic. And we'll also be able to see things like observations as well. So especially if somebody's health is starting to deteriorate because of something like diabetes, for example, any observations the GP is making and adding to their GP record, we'll be able to see that information in here. We recently did, or this year, we did a round of analysis on GP Connect with past users that are using it. And on average, this is saving around about 30 hours a month by having access to this information. For some care providers as well, it was saving anywhere between £500 and £600 a month by having access to it as well. So not only is it time saving, but it's the cost behind that time associated to it that they can then invest elsewhere in the business. Another area that we do have in pass in terms of auditing, whilst we do have the timeline and things like that, is we do have pass reporting. So pass reporting has been designed to be really flexible for care providers with regards to the access that they can have within the system for various different data points. You'll have to forgive my demo office because our demo offices aren't live data, so sometimes it takes a little bit to wake up. In terms of the different setups, if a customer is on care planning only of pass, they'll have care delivery reports, customer and employee reports. However, a customer that is on our all-in-one solution that does have our rostering, it opens up additional reports such as things like holiday entitlement and pay, time and attendance, scheduling, and also finance reports as well. One of my favourite reports that I go into in here, because I'm not very good with logging into my demo office, is my punctuality. And a lot of customers really enjoy this report as well, because not only can we see the last 7 days, if I change this now to the last 90 days, and I can also use a custom date range. I've also got advanced filtering that I can pull out on the right-hand side, so I can then be really specific with what I'm looking for. But then I've got filters here as well. So I can select filters such as customer name, employee name, punctuality difference, and booking status. What that allows me to do is I can then save that as a favorite selection. So rather than recreating the same report each time, especially if they are looking at a specific employee's punctuality, they can save that report and then they don't need to recreate it each time. Here we can see, for example, and this is where I always smile, I am never on time for any of my visits. So I can see that over the last 90 days, I've had 0% of my visits have been on time. These are my staff that I've been using to tag in and out of visits. But further down, it then breaks it down based on employee punctuality. So we can see 83% of Stephen's visits have been late. He's also had 17% where they've been early. Gurdeep has had 67% that have been early and 33% that have been late. And it also breaks it down by customer as well. So you can start to see that kind of beginning part of the continuity stage on, are we attending visits early or late? That then allows businesses to take an informed decision on, actually, do we need to move the visits, even if it's by 10 minutes, because actually where the visits are at the moment, the care staff are always arriving late to them. If, for example, we just want to look at miles and we want to look at the ones that have been early, I can select this section on this chart. The rest of the data will then update it to just show me the visits 4 miles. So we can see here that 4 miles, we can see the employee name, the status, the planned start time and the actual start time versus the planned end versus the actual end. It will also give us the punctuality difference and whether or not we were early. So we'll start to break down that data. And all of this information is exportable as well. So I can download this to a CSV file and then I can do what I want with it. What's really nice with Pass as well is I can take this and I can also export this image. So I don't need to, again, export the data, fiddle around with it in Excel and then recreate my own charts. I can download the image of this and then use that in any other reports as well. We've got additional reports, especially in the finance side of things. I generally tend to start looking at things like the service agreement planned hours report. This is a really useful report if I look at the last 90 days in here, where I can start to see over the last 90 days what have been my chargeable planned hours versus my planned visit hours, and then what have my expected charges been. So businesses can start to see and forecast going ahead. And again, all of this data is exportable. On the employee side, we can also start to look at time and attendance as well. So this is where I can start. And again, I'll change this to the last 90 days just because it makes it look a little bit more colourful. We can start to see, what's the actual percentage of our duration of visit hours? What's our delivered hours versus our planned hours? What's our tag in method versus our tag out method? And then again, we've got things like visit punctuality by employee, the time spent at visit by employee, and then we've got our booking details here as well. And again, all of this data is exportable. In terms of medication audits, I can use the medications report. So here I'll be able to look at things like the medication completion status. Again, I'll do this the last 90 days just so I've got my data in here. So here we can see that we've currently got 82% that have been completed. We've had 3% that have been missed, and we've got 15% that have been partially completed, and that could have been for various other reasons. We can also see how many medications were a PRN. The medication distribution is an interesting one because this is a fairly large amount of detail here, and it's actually only showing us a small amount of it. So I can move this and I'll be able to then look specifically in specific areas without having to have everything in that single view. If I then, for example, just wanted to have a look at the ibuprofen 10% gel, we want to have a look at the ones that have been missed, I can select that. The data will then update itself to show me that we've had those missed ones are all with Sheila Gardner. And then we've got the detail down here at the bottom as well. So there's lots of flexibility and functionality that's built into the reporting. If there are reports that people do want to have within Pass, if they are not already there, we can look to build bespoke reports for people. They may carry a cost association to those, but we would have a full scoping session to see what the requirements of that report is. It may just be that actually in some of our newer reports, they're just not sure what data is in there. So that we do have additional training sessions that are available as well. One of our really popular places for people to start doing audits is in the customers. Every customer has their own care note section. So in here, I can start to audit at visit level. I'm going to go back a little way just to find a visit that has actually been completed. In fact, I'll remove the missed ones. So we can see here, we've got this visit. I can clearly see this is the time that my carer tagged in, the time they tagged out. I was in this visit very quickly. It was Stephen Nichols who logged in. It's completed. It was the morning visit. And then everything here has been completed because it's showing as green. But if we look at this morning visit, we've got one that's showing as amber. So what I can do is I can actually click into this and I can see the notes against each task that the care worker has added into the app. Any detail that's been added against any of the individual tasks, I'll be able to see those in here. If they've uploaded any images, I'll also be able to see those as well. But we can see as well a body map. So we can even see where they've highlighted any areas on a body map and also added notes. We can see that Stephen said that Sheila's right knee was sore today. So they get all of this information directly in here. And then we've got the bed change one, which we've put as it hasn't been done as it wasn't required. And we've got the notes of not required today. We changed the bed on Friday. And the alert was then resolved as not done for a specific reason. So that gives people the ability to audit at what we call visit level. One of the features in here is, as I mentioned previously, the timeline. The timeline is where you can start to audit at task or action level. So if, for example, you want to do a medication audit, I can select my event type. So I'm going to select actions, and then I'm going to go for medications. It's here that I can change my date range if I want to, or I can just scroll down. I'm going to go back to the 8th of October. And now I can see the 9th of October, I've got the 8th. It will also show me beyond that as well, so they can keep scrolling to see anything they want to see. But here we've got all of the different medication tasks that have or haven't been completed. So if I take this oxygen performance masks, I can click into this, and not only will it show me the detail that was added into the care plan, but it will also show me the notes that were added by the care worker at the time. But what I can then do here is I can add a review note. So I can add a review note here, let's say completed, and hit submit, and I'll be able to see who completed that review and when, and the notes against that as well. There's also the MAR chart, and the MAR chart is a place that gives people the ability to start looking at how medication is administered over time at a single glance. It gives people that visual to really quickly identify, actually, do we need to do a medication review now with somebody, or a deeper review with someone? Because it allows them to see, has anything been completed, which will show as green. Anything that's been partially completed will have a reason code and will be amber. So if, for example, it's a reason code of 3, which is refused, the MAR chart in past gives people really quickly the ability to say, actually, why is it that the service user is refusing this medication on a more frequent basis? Do we need to do a review now, or are we okay to wait until their next medication review is due? Anything that's pink with employee initials means they're in progress in the future at the moment. Anything in pink and blank is missed, and then the grey ones to be done in the future. But you can also print out the MAR chart as well. So people can print out the MAR chart. It will give them the view. So I'm looking at October, for example, and I can either print that as a portrait or a landscape and print that off as I need to. Another feature in past that a lot of people do use, and it was a big piece for us in terms of delivery for not just the care provider, but how friends and family can be involved and feel part of the care package itself. And that's using our OpenPass platform. So I'm just going to log in as Graham here. And we do have two sides of the platform. There is the web side of OpenPass, but there is also the app as well. So generally, family members, friends, they will log in using the OpenPass app, which is a free of charge download on Android and both iOS. I use for demo purposes the website because it allows me to see really quickly who have I got a visibility to, and it's all consented access. So it's generally useful for friends and family that have been given access by the service user. And anyone who has been given access, you'll be able to see who's been given access in here. You can also revoke that access as well. It's really useful for power of attorney. A lot of care providers will send people a copy of the care plan. By having access to OpenPass, they can see it. In the app version of OpenPass, they can also communicate with the care provider as well. So they can send messages to the care provider can also respond to them. But if we click onto Chloe, who I've got access to, I can see her address details here, and we can see that she's active, and I can see her profile picture. And by clicking into her profile, this gives me exactly the same view that the care provider has, but in a read-only format. So again, I can go right back and I can see, what visits have been completed. We can see that we've got some here where they're amber. This one has been fully completed. And again, I can see all of the notes against this. I spent some time with a lady who used a friends and family app for her mum who was receiving care and she was a diabetic. It was really useful for her. They weren't using Pass, unfortunately, but it was really useful for her that if the visit hadn't started on time, she could phone the care provider and be like, nobody's there. My mum needs to eat because of her diabetes. And when her medication is due, do I need to get there? So it allowed her to feel really connected to the care that was going on and see the outcomes as well. And especially when, unfortunately, her mum started to deteriorate in her health, she could see that in there. And it allowed her to go to the consultants that were working with her mum to go, this is the care that's being delivered to my mum. Is this correct? Do you recommend there to be any changes? So they feel really informed when they're part of those kind of medical conversations with their loved ones. They can also view in here as well the care management tab. So this is where they can see the care plan that's been created. So especially for people such as power of attorney, they can go, actually, do we need a new outcome, or are these the right tasks? Is there additional support that's needed? Are these the right number of visits that should be happening still, or do we need to add in another visit, or actually do we need to reduce them down? And then they can also access the information page, which gives them the About Me section. So Pass has a really comprehensive About Me section. It also shows them the care receiver details, the doctor information, and also who the next of kin is as well. And all of this is in a read-only format. They've also got access to the help centre, so they can access the help centre for OpenPass. And as I mentioned with the app, they can actually communicate with the care provider directly. In terms of support and ongoing support for care providers that are using Pass, we've got a number of different ways that you can access support. In the office itself, you've got the little question mark icon here. I can click on this and it will then take me to the help centre. And this is where I'll be able to access any of the articles that we have created. So for example, I can go into my getting started one. This allows me to see any webinars that have already been completed. This is a much more sort of streamlined one for our demo offices. Our actual help centre is much larger than this. But again, I can also see things like a quick guide for the Pass for Care app. So I can then read through the article and I can see all of the detail in here. The great thing for your care staff is they can also access that in the app as well. So if somebody has forgotten how to do something, they can go to the help centre within the app and they'll be able to self-serve. The support that we do offer is 24/7, 365. So support is available to everyone at all times of the day, and that's via email, phone, or live chat. So they can speak to somebody on the phone. We also have lots of resources that are available as well, such as different training webinars that people can join. We also do various different webinars that are available around specific subjects and topics, like we recently did a webinar on GP Connect. And that's just so that this information is available for people to feel like they have the ability to know how to use the system. So for us and around our training and development of using Pass, it's about having the empowerment to know how the system works, rather than feeling like you have to rely on a software provider for everything. So we teach people in a train the trainer method so that they can then train their staff, but it then also gives them the ability to go, this is also our own training manual for when we're onboarding our own staff members internally as well. So it very much gives them that empowerment to do that. Live chat at any point is available through the little icon on the right hand side here at the bottom. So I can click on this at any point and I can speak to somebody in the help centre. And that's pretty much it. I mean, in terms of Pass itself, we've got some really exciting things that are coming up. And one of them I would love to show you at the moment, but it's currently going through our design phase, is enhanced dashboards. Those are coming up for 2025. We've released a lot of additional features and functionality in the rostering side as well, and we've got more coming up over this year and next year. Pass has been around for 10 years now, so we've had our 10-year anniversary last month. And we've grown dramatically from a couple of people talking about it as an idea on the side of a sort of Saturday morning football club to that we've got nearly 70 staff. We're fully UK based as well, and everything is done internally, from our engineers, our design, the sales team, account management, and customer services as well. It's all UK based. That's pretty much a little bit of a nutshell, just into some of the core features that really do just take pass to the next level for people, rather than it just being entering care plans and people completing tasks on the app. There's loads more that we're looking to bring out to make it really really exciting and really interactive for people.
Thank you very much,
Brilliant.
Jessica. May I jump in with a few comments/questions, Mel? Is that okay? Well, once again, thank you. A lot of functionality in the system, right? So for those of who might watch this recording and are proficient users of Pass, there were a lot of golden nuggets in the presentation. If somebody, however, was to look at implementing Pass or switching to Pass from another system, what's the process? I mean, do you offer ongoing support, training? How easy will it be for them to possibly explore a transition? If you can talk us through those steps, that might be helpful for those who might have found the amount of information overwhelming.
Sure, absolutely.
And thought, let's look at the initial steps.
Yep, so absolutely. So in terms of onboarding, everybody goes through a similar onboarding process flow. Everybody gets access to their own project plan, so they can see the steps that they're going through during the implementation. There'll also be designated actions for both us to complete and also the care provider. The training sessions that we do are actually webinar-based training sessions, and that's so that what we then do outside of that is the implementation manager will then spend time looking at the specifics that are just specific to that care provider, but the overall training on how to use the system is available for everyone. We've recently made onboarding in Pass a lot easier and a lot faster, because now we've almost moved beyond people going from paper to digital to people moving from digital to digital. And that in itself is a hugely daunting task, with the amount of information a system can hold on someone. So we're currently running an initiative with customers that are onboarding with Pass, and not just onboarding from a completely different system to going to Pass, even if they're upgrading from our care planning to our all-in-one, is the ability to lift and shift data from one system to the other. Our standard implementation time used to be about 3 months, and we would go through a process of various different training sessions, and we would have a go live date. Some people would want to have 2 systems running alongside each other and do a phased implementation, and we can totally run on somebody's individual timescales. However, I have had somebody completely on board from one system onto Pass as a completely new customer, and they were a fairly large customer as well, in 2 weeks, by being able to lift the data that they have from their existing system and move it into Pass. And that's even using things like CSV exports and things like that. So we have a very clever system architect who's been able to build and design this. And it is so that people don't go, there's too much for me to move. I know this system could actually be so much better for me, but I'm frightened of moving. So we've put this in place to kind of put that panic and put that reassurance there, so that people can then feel this is going to be really easy for me to move, and my staff are going to find this so much better.
Brilliant. Thank you for that. Well, you touched on something very interesting. We're no longer looking from people moving from paper to digital. We're looking from people moving from digital to digital. And personally, I think that the market will keep on shifting while care providers become more and more accustomed to digital ways of working and figuring out what system best meets their needs. Obviously, you're able to sort of view what your users are doing with the system, right? Mm-hmm. So you can see which pages they access, which features they access, and that's being implemented and taken into account when you're developing new features. Are you able to sort of give us some insights on whether you're witnessing people looking for more functionality and actively exploring the plethora of options that the systems offer? Any sort of insights on that, on how things are shaping?
Absolutely. So our operations dashboard that we're working on, that actually came out of a customer session that we ran up in the north of the country with, I think it's about 25 of our customers, and we were looking at, what is the number one thing that from an operations perspective is going to make your life easier? Because people will want to look at so much data in one go, they can have so many different reports open, that's where that came from. everything we do in Pass comes from our customers. So Pass was originally care planning only. We didn't have our own, or we didn't have our own roster. The reason we created our own roster rather than buying our own roster and just having a standard integration was because then we could design it with our customers. So we have a working group of customers that we work with. We also raise feature requests and feedback. We're currently running, in the background, we run what's called Pass Pilot. Pass Pilot is used to look at where system utilization is for customers. And it will also start to recommend for them, once we've fully released it, it will start to recommend articles and things like that they should read if they're not using a specific part of the system very much. So we can really start to look at what are the areas that people are really using, how much time are they spending there. We can also push out things like NPS surveys and things like that in there as well, but it allows the account managers to then, when they're doing their regular account reviews and check-ins, to go, you're not really using this part of the system very much, but actually it'll be so much beneficial to you if you start using it. Do you want to join a training session for it? Do you want to watch one of the previous webinars? So it gives us that insight into our customers. So that's what we're calling, its initial name is Pass Pilot. That's what we're calling it at the moment. But it will start recommending various different articles and things like that to customers as they're going through the system. And especially if somebody is a new user, it will start to recommend lots of things that they should sort of look at using and reading and utilizing whilst they're going through learning how to use the system.
Thank you very much, Jess. Much appreciated. Thank you.
Thank you, Alex. Yeah, thank you, Jess, as well. It was very, comprehensive look at kind of the advanced features and things that are there. And it's really interesting, because I think locally from providers we spoke to, is they've kind of got on board with the care planning, and actually they're wanting more now. Like you were kind of introducing other parts. It's it's interesting to see they're looking at more of the regulatory kind of framework and producing that type of thing. So it's interesting to see that Pass has already kind of developed that type of thing as well. Just a question around, obviously you mentioned kind of GP Connect, and so can you give us kind of the links to that afterwards, and we can send that out and attach it to our kind of recordings so that people can kind of get more linked in with that. That would be really helpful. And just really a kind of question around how you see sort of AI in the development of Pass. How far are you talking about kind of integrating that type of thing, and where are you at the moment on it?
So you'll probably see that I have got ChatGPT open. I use ChatGPT a lot, more so because I am our CRM's administrator, so I use it to do things in there. But our system architect, he's currently using AI in terms of building things in the system. One of our initiatives for next year is how AI can be used in making data related decisions. A lot of people, I think, are using AI in terms of scheduling, but I think you still have to remain really in tune with the fact that scheduling it can't just be driven by a machine. You have to have the emotion and the connection to the individual and understand what it is that they need to make that informed decision on who's going to be the best person to go and visit them. So we're actually looking at AI in a completely different light. We're actually looking at it to make data-driven, informed decisions, rather than just we can use AI to build a schedule for us, because actually that schedule could be totally wrong, because AI is still very new. It's a new thing. It's very much like when mobile phones came out. Everybody used to laugh that somebody would have a phone the size of a brick with a little aerial that would pull up. Now we've gone from having tiny mobiles to now they're getting bigger again. And I think AI will very much go in the same way. But no, AI is something that we are definitely looking at, but we want to look at it from a completely different standpoint and make sure that it has a really quantifiable benefit to the business that's going to be using it, rather than just potentially causing more work off the back of it and having to make changes. So we're not going to rush any releases on anything to do with AI, but the engineers and the design team are starting to look at those already, and we are using them. We're using ChatGPT and things like that internally anyway. just because it helps us and it gives us something else that perhaps we might not have considered. Because as much as, you know, we want to be able to be really open to everything, sometimes we can be a little bit like tunnel vision. So it just opens our own minds up a bit. Even in terms of some of the things like we've just done our Secret Santa, and rather than just calling it Secret Santa, go on to ChatGPT, can you give me some other names for Secret Santa? And it's done that. And it's gone, I didn't even think of that. So yes, AI is something that we are looking into at the moment. And yeah, that's an initiative that will be driving into next year, but it will be very much around the data side of things.
Thank you, Jess. I know what I'm going to do after this meeting now. Go into
ChatGPT
and ask it. Yeah, ask it a few questions.
Ask
no,
it
that's
to
really helpful
produce
because
a roster for your organization.
yeah.
So that's always a challenge.
Really, it's really interesting because I think, yeah, it's, you know, the sector we're working obviously very people based, and there is that risk that you don't want to lose that personalization as well. So it's good to see it being considered at that kind of level and how it can be integrated into systems without taking over and making decisions. So that's brilliant. You briefly touched on obviously there was quite a lot around the resources and webinars that people can kind of tap into in training and that type of thing. How are users kind of made aware of system changes? Because obviously a lot of that can get missed in sort of the comms that are going out. So what's the kind of normal procedure for that type of thing?
So what happens is, let me just go back into Path quickly. Just go out of here. So what happens is whenever there's an update made in the system, they get a blue banner that appears at the top. So it pulls the screen down. They have a blue banner. Whenever they go onto our intercom as well, if there is an important update, they'll also get presented with that message in our live chat system as well. We also send email communications out. So all of that information is available so they can see it at various different points. It's not just a one place and it's there in multiple places, so that if they have missed it, because sometimes people just click out of stuff, they can then see it somewhere else as well.
Super, thank you. That's all the questions I've got. I don't know if there's any other further questions from anybody. Just give it a couple of seconds. No, okay, I think.
Oh, sorry, just took a while to unmute myself.
Of course, that's okay. Go ahead.
No, thank you. It was a very informative and detailed presentation. And to be honest, we don't have passed, but I'm just looking at it and I wish we would have passed. So that's why I was here, just to see how it is working. Thank you very much for that.
No problem. If you are interested in having a deeper look, you know, feel free to reach out and we can always get a tour scheduled in so that you can have a look at it in a bit more detail as well.
Thank you.
Thank you, Christina. Yeah, it's interesting, isn't it? I think, you know, yeah, people, it's useful to dip into things like these because you get a bit more of a feel for things. So you're obviously very welcome to. Okay. In that case, I will draw us to a close and obviously thank Jess very much for a really informative session. It was really helpful and certainly to us as well, working with a number of systems. It's really good to see these types of changes and how it's developing. So yeah, thanks for everyone's time and we'll see you soon, hopefully.